Summary of the Inflammatory Response and Immune System lecture. 1. Inflammatory response and innate immune system. The inflammatory response is part of the innate immune system, which is present from birth. Inflammation can be caused by infection via pathogen-associated molecular patterns, PAMPs, or sterile inflammation via damage-associated molecular patterns, DAMPs. Both use pattern recognition receptors, PRRs. After an infection is cleared, sterile inflammation can persist due to tissue damage, which may lead to poor outcomes. 2. Cytokines in inflammatory response. Pro-inflammatory cytokines are produced during inflammation and help mediate immune responses. Cytokines like interleukin-1, IL-1, and tumor necrosis factor, TNF, activate inflammasomes and the nuclear factor kappa B, NFKB, a key regulator of inflammation. NFKB induces further production of pro-inflammatory cytokines, amplifying the inflammatory response. The cholinergic system, activated through acetylcholine, can inhibit NFKB, thereby suppressing inflammation. This has clinical relevance, particularly in surgeries where it can prevent post-operative complications like ileus, paralysis of the gut. 3. Pleiotropy of cytokines. Certain cytokines, such as IL-1, have multiple effects on different organ systems, e.g. brain, skeletal system, and bone marrow. Cytokines can also have redundant functions, e.g. IL-1 and TNF both induce fever by acting on the hypothalamus. 4. Types of cytokines. Pro-inflammatory cytokines include IL-1, IL-6, and TNF, which promote inflammation. Anti-inflammatory cytokines, such as IL-10, act to suppress inflammation and balance the immune response. 5. Cytokine storm and systemic inflammatory response syndrome. An excessive release of cytokines, known as a cytokine storm, can lead to severe complications like SIRS and sepsis. If cytokines are overproduced due to infections or trauma, they can cause systemic effects, resulting in sepsis or sepsis-like syndromes, even in the absence of active infection. Cytokine storms can result in multiple organ dysfunction syndrome, MODS, and markers like procalcitonin and ferritin may indicate poor prognosis. 6. Acute phase response. Pro-inflammatory cytokines like IL-1 can trigger the liver to produce acute phase proteins, such as C-reactive protein, CRP, fibrinogen, and alpha-2 macroglobulin. CRP is often used as a clinical marker to assess the level of inflammation. During acute inflammation, certain proteins like albumin decrease in production, while others like CRP increase. 7. Sterile versus infectious inflammation. Systemic inflammation can occur in both sterile conditions, e.g., trauma, burns, lupus, and in response to infection, sepsis. Sepsis-like syndromes mimic the symptoms of sepsis, but occur without infection, often due to severe trauma or immune disorders. 8. Multiple organ dysfunction syndrome, MODS. MODS can occur in both sepsis and sepsis-like conditions. Biomarkers like alpha-2 macroglobulin and procalcitonin are used to assess the severity and prognosis. 9. Neurohumoral response and sickness syndrome. Inflammatory cytokines can affect the nervous system, leading to symptoms like malaise, fatigue, sickness syndrome. The release of pro-inflammatory cytokines triggers a neurohumoral response, impacting the body's ability to regulate itself during illness. 10. Regulation of inflammation. A balance between pro-inflammatory and anti-inflammatory cytokines is essential for a healthy immune response. The suppressor of cytokine signaling, SOX, pathway acts as a feedback mechanism to prevent excessive inflammation by promoting the release of anti-inflammatory cytokines like IL-10. 11. Role of corticosteroids. Corticosteroids produced by the adrenal gland are anti-inflammatory agents that help control the immune response. They can inhibit pro-inflammatory cytokines and reduce the risk of cytokine storms. In some cases, corticosteroids are used therapeutically to manage inflammation and prevent complications from cytokine storms, particularly in sepsis or systemic inflammatory conditions. 12. Clinical relevance and treatment. Understanding the role of cytokines in inflammation has led to therapies such as cytokine-neutralizing antibodies and corticosteroids. Proactive management, including the use of cholinergic activators, e.g. neostigmine or corticosteroids, can help prevent post-surgical complications or excessive inflammatory responses. Final notes. The balance between pro-inflammatory and anti-inflammatory cytokines is key to maintaining health and preventing excessive immune responses, such as cytokine storms. Early intervention in sepsis and sepsis-like conditions is critical to improving patient outcomes, and ongoing research aims to improve therapeutic approaches for managing inflammation.